My philosophy for treating patients has quite a few different layers. First and foremost, when we're talking about children, I like to be proactive and preventative so that when they're a little bit older, we have a lot more options to be able to treat them more conservatively and give them beautiful smiles without having to make any sacrifices. So we do use some phase 1 therapy or early orthodontics when kids are 8 and 9-ish age range. But we also are conservative and only use that when absolutely necessary. I love to be able to give an 8-year-old kid a high five and say, see you next year. Hopefully you lose a couple baby teeth and we'll wait for all your permanent teeth to come in. But sometimes kids at that age range do need a little bit of help, whether that's doing something to make a little bit more space or some growth modification. There's a lot of things that we can do to make their lives and their parents' lives a lot easier when that final set of braces comes, when they're in the 12, 13-ish age range. And when it comes to our adult patients, I like to give them options. Some of our adult patients like to use braces and want to use braces to give them the smile that they had always dreamed of, maybe because they didn't have a chance to when they were children. And some of them would like to use aligners to get the job done. And here at Heinz Orthodontics, we give them both options. A lot of different reasons that adults come to see me. Some have breathing issues, sleep apnea, and those kind of things. Some of them just have crooked teeth. Some of them are riddled with dental work their entire life and are finally ready to be proactive and preventative with their oral care. There's a big difference between an unhealthy bite and how your teeth come together and function versus a really healthy, solid bite where everything's functioning off of each other and working in harmony in preventing future dental care. And in our teenage age range, that's kind of our bread and butter, the 12 to 18-ish age range. The 12 to 18 age range, those kids, they have a mind of their own, of course, and some of them love braces, some of them love aligners. Fortunately, we give them both options here. Some people have the idea that because they have a really significantly crowded bite or a lot of different things going on, that they might not be a candidate for clear aligners like an Invisalign or a Spark. But in fact, they do. We pride ourselves on delivering that for our patients and giving them those braces-like results using clear aligners.